Hi there.
Hello.
My name is Bill. I'm going to be seeing you today at the clinic. I'm a nurse practitioner student in Spring Arbor. So what's bringing you in today? What are we doing here today? You're Kelly, I understand?
Mm-hmm.
What brings you in today?
I just was wanting to seek some advice on an exercise regimen. I am wanting to lose weight, and I recently started trying to work out on my elliptical, and I couldn't get too far. I started to feel really poorly and just didn't feel like I could keep going, and so.
Okay. Can you describe to me your exercise regimen? I know you mentioned you recently obtained an elliptical, and it sounds like you felt more winded than you did before. Perhaps you're more out of shape. Can you explain that to me a little further?
I got really out of breath, and I started to feel lightheaded, and it just kind of made me feel less enthused about trying again, because I just feel like I can't do it.
I can understand how that'd be a little bit disheartening to not be able to quite do what you could before. I can understand that, but it's good to start out lower and then go a little slower until you reach your goal. A lot of organizations, I know American Heart, they recommend 150 hours a week of moderate intensity exercise. So ideally about 30 minutes, 5 days a week. But I know for a lot of us, we're pretty busy. It doesn't work. I understand you have small children at home.
Mm-hmm.
That's very difficult. I can understand that. But it sounds like you're making a lot of headway towards it, striving to do better.
Mm-hmm.
I know that's a constant battle for us Americans, eating right and obtaining exercise, getting sleep, all those sort of things that would promote our overall health. So what are some of the reasons you want to exercise more?
Just to be healthier,
Okay.
lose a little bit of weight, have more energy.
Definitely. That's great. Yeah, all those things can help. Again, I think it's making little steps, little sacrifices, and acknowledging what you've done. I think it's great that you've made any step towards that. That's the first step in getting better. I think it's fantastic that you're putting yourself out there towards that, trying to better your health. Not for only yourself, but for your family as well. Also, you should get more longevity out of life. And I know that you mentioned before in the past that you're concerned about osteoporosis with your height, and your lack of exercise previously, which is okay. I understand that entirely. Life's very busy. Children are very difficult sometimes. It's a lot. But that's great. Those sort of things can help prevent osteoporosis, cardiac disease, can decrease your rates of mortality and coronary artery disease. There's been studies that have shown it can drop tremendously just from exercising a little more, even without modifying diet. Have you worked on diet at all? Have anybody talked to you about eating a little better? I don't know. What do you normally eat? What sorts of foods?
I guess I am more inclined to try and exercise because I'm a bit of an indulgent eater.
You say you're a foodie. It sounds like you like to eat fancy foods and such.
Fair enough.
That's understandable. Salt, fat, and fire, and heat, right? That's all where flavor comes from, unfortunately. So maybe it's small little sacrifices. I know you mentioned previously you like to drink a lot of water. That's great. I mean, that's where a lot of us get empty calories. It's like the sugary drinks and that sort of thing. So even just small little sacrifices like that, like drinking more water and just eliminating that daily pop or whatever, that soda, that sort of thing, you can shave just a ton of calories off. And definitely, I agree, depending on your genetics especially, I think exercise is overall very important. Diet's important, as far as the anti-inflammatory effects, and also, calories and cardiac risk, but exercise is really where it's at, especially if you have the genes behind it that are just going to allow you to get a lot of good results. But I think it's important to acknowledge everything you've done, though. That's fantastic. I think we could go from here if you'd like. I know I've had patients tell me in the past it's worked just doing a journal, positive affirmations, things they've done to help them lose weight, or to just obtain more energy or whatever life change they're trying to make to better their life.
Right.
It is important to sit back and acknowledge all the good things you've done too, though.
Yeah.
Sounds like, and you do look like you take care of yourself, so that's important. Definitely.
Thanks.
Yeah, definitely. Do you have any more questions from our visit today?
I don't think so.
No. Do you have any other concerns at all?
I don't think so.
Okay, all right. Sounds good. Well, we look forward to seeing you in a couple weeks. I'd like to try to start journaling if you're okay with that.
Mhm.
If that seems like a good idea to you.
Mhm.
Again, like we talked about, maybe start out slow. Maybe try to do 10 minutes at a pace that you would call maybe a 5 out of 10 for you.
Mhm.
On the elliptical and kind of do that. Maybe we can start out 2 or 3 days a week if you have time to do that. If not, that's fine
Baby
too.
steps.
Yeah, if not, that's fine too. We'll just keep track of it. We'll kind of go from there. And if you have any further concerns, don't hesitate to contact the office. We'll see you again, and look forward to hearing how well you're doing. Okay.
Sounds
Thanks.
good.
Thank you, Kelly. Have a good day.
You too.
Bye.